Hello, my name is Ines Kim. I'm an undergraduate rising senior at the University of Illinois Urbana-Champaign, and I am majoring in brain and cognitive sciences with a minor in computer science. My research is on convolutional neural networks, using brain-computer simulations for potential non-invasive schizophrenia and psychiatric treatment as an alternative to medication. Computers and brains are very similar to each other. Computers, especially neural networks, have been heavily modeled by the brain's neural connectivities. The purpose of this study is due to the lack of non-invasive and side effect-friendly treatment options with a monopoly on oral medication. I will jump into the related studies of understanding schizophrenia, current treatments and shortcomings, deep learning in psychiatry, and discussion of studies in using AI and neural networks in mental disorders. To first understand, what is schizophrenia? Schizophrenia is a psychotic disorder categorized by a variety of combinations of positive and negative symptoms, differentiated by an absence of normal activities, as especially lack of emotional processing, avolition, and asocial characteristics, or presence of abnormal activities such as hallucinations, delusions, and altered thought. What causes schizophrenia? Though we do not know the exact cause of schizophrenia, we do know it is influenced by risks in genetic factors, birth factors, and brain abnormalities. There are three current hypotheses that are very popular in schizophrenia research, including the dopamine hypothesis, the glutamine hypothesis, and in our interest, the disconnection hypothesis. Dopamine and glutamine hypotheses argue over the excess of dopamine in the brain and respectively irregular NMDA receptor signaling. The disconnection hypothesis, though, most importantly, is described as the disconnectivity of neural circuits that lead to schizophrenia. But this raises the question, if schizophrenia is caused by the disconnectivity of neural networks, could we connect this back as a form of treatment? There are also some harmful stigmas and media representation. There are also some harmful assumptions about schizophrenia, particularly stigma and media representations. In media and popular culture representation, it reveals psychotic disorders as sinister, dangerous, and psychopathic to those near individuals with these symptoms. Movies like Split and Willy Wonka have shown people to be Movies like Split and Willy Wonka have shown characters to be wildly erratic, fearful, and dangerous to those around them, Split being a movie about a kidnapping. However, plenty of evidence has been discovered to find that individuals suffer more from violence and that these disorders are just from risks including genetics, brain abnormalities, and birth factors. We still need to find the underlying cause. For current treatments in psychiatry and medication, we have the large purpose for this study is due to the lack of effective and consistent methods of treatment within psychotic disorders, mainly revolving around oral medication and cognitive behavioral therapy. As introduced earlier, common shortcomings of treatment in these disorders circle back to unpleasant side effects, chances of treatment resistance, and worsening or lack of effectiveness in negative symptoms. Side effects themselves may be enough persuasion to push patients away from medication, as it may involve other issues with weight gain, disturbances in glucose, lipids, insulin, and cholesterol affecting physical health, and has been shown to raise risk of anxiety and depression. This is a very heavy weakness in oral medication in antipsychotics and antidepressants, as raising the risk of anxiety and depression and mental health disorders, on top of the pre-existing mental health disorder can be very distressing to patients. The current deep learning field in psychiatry and schizophrenia is very small, as we find only neural networks have been only developed to diagnose disorders. But first, what is a neural network? To briefly review the concept of a neural network, it begins with an input layer and ends with our output layer. And in between, we have hidden layers consisting of nodes with specific weights, each with specific weights in between. These hidden layers were modeled by how our brain neural circuits are connected and thus can be trained, with those weights on specific nodes tied to other nodes in different layers that eventually lead to our output. There are still concerns with the difficulty of training these models within psychiatry, especially with our issue of backpropagation. However, even with the limitations of neural networks, we have found significant progress through extensive training and closed the gaps between theoretical models and biological evidence. Current schizophrenia research with diagnostics in neural networks have shown an accuracy of around 81 to 99%. Our specific interest lies in convolutional neural networks, which is a neural network but with more effective results in spatial resolution, such as images or brain activity shown through EEG or fMRI activities. However, we also have limitations in these, as convolutional neural networks, as other deep learning algorithms do, have large computational costs as the hidden layers increase, which makes it difficult to quickly have our results out. Andrew and al. In a study under Andrew et al., he stresses that there should be more research on AI and mental health, and that priority should remain on the human compassion and treatment for the meantime. However, there are still multiple calls in the hope for advancement in utilizing AI in healthcare fields. For my methodology, I've utilized Oligarch's dataset with 28 total subjects, 14 healthy and 14 schizophrenic patients. And I also intend on using 2 other datasets in future editions of this research. I use MATLAB and EEG Lab to proceed to include necessary channel locations for the standard 10 to 20 EEG cap of 19 nodes, as used in Oligarch's dataset. This raw EEG dataset was then converted and filtered through the EEG Lab's filtering process. And due to time limitations in modeling out epochs with the current dataset, as this research was completed in a 10-week NSF RU, the plan to develop a similar convolutional neural network diagnosis was pushed for future developments. I intend to provide a convolutional neural network that I intend to create a convolutional neural network that I intend to use a convolutional neural network along with a brain stimulative technology in order to provide both diagnostic and treatment techniques. But for my first part of this process, I initially developed independent component analysis on each subject and have shown the different patterns of brain activity in each patient in order for the convolutional neural network to analyze which areas of the brain are more accurately inactive in schizophrenic patients. So in our discussion of of current studies in brain and computer interface, we can jump into Sergio and al.'s proposal of fMRI and brain-computer interface technology. Their methodology consists of training patients to self-regulate and manipulate their brain activity to be read by fMRI readings. Using the self-regulation and manipulating the brain activity was mainly focused on activating the insula to be read within the fMRI readings. But, however, a shortcoming in Sergio and al.'s suggestion is that though training of self-regulation may provide immediate results, patients with psychotic disorders who experience positive symptoms such as hallucinations, delusions, hyperactivity, and thought disorder may have difficulty in reorganizing their current symptoms within the moment. If they were to suddenly have a relapse, it would be difficult to escape their current hallucinations and current state in life and reactivate their insulas to retain a normal state of mind. As it is commonly recognized that schizophrenia lowers quality of life, including a prevalence of abolition, which is a lack of motivation, it is difficult to expect much individual progress without outer assistance. There also exists the evidence that self-regulation may be interfered with by factors, shown through a negative correlation of self-regulating and negative symptoms in the duration of the illness. If the larger prevalence of negative symptoms inhibits the fMRI BCI methods, it may be beneficial to investigate increasing BCI studies on schizophrenic patients. Papanaccio and al. Delves into utilizing EEG neurofeedback with BCI through virtual environments and video game-based learning, which is different from Sergio and al.'s approach of training the patients. This uses an outer device which eases the burden of independent pressure to regulate connectivity by adding assistive tools, such as the video game. Most studies of the visual environments were conducted on children with attention deficit hyperactivity disorder, ADHD, and dyslexia, with favorable results in diagnosis and improvement of symptoms, including improvement of attention and hyperactivity. It is also significant to include that there was an additional review on the developments of understanding brain signals in children with autism spectrum disorder, providing a communication bridge, as the BCI was able to depict through brain activities what the person was trying to convey, as they have a communication barrier. However, overall, there is a conclusion that there are difficulties in creating a universal BCI system available to each and all individual persons due to brain signal variability, with about 50% of individuals that will not respond to BCI technologies due to the such large variability. A different study conducted by Dada and al. On obsessive compulsive disorder, OCD, also found success in using BCI training to detect and plans to further improve cognitive control with it. Overall, there seems to be a consensus that there needs to be further testing to ensure reliability in diagnosis and treatment. For potential routes, the hypothesis that schizophrenia circulates from decreased neural connectivity as seen in our disconnection hypothesis, this raises questions of potential path in different technology. The use of electroconvulsive therapy, ECT, and convolutional neural networks, findings of brain activity together. As previously noted, electroconvulsive therapy was originally a method for managing psychotic disorders such as schizophrenia. There is an evaluation that ECT was found to be recommended for patients with a difficult number of negative symptoms, along with those who are drug-resistant with depression and anxiety. Though this is rarely seen in modern day, There is still strong evidence of the effectiveness of the use of ECT for schizophrenia, as we have seen success in depression and anxiety patients resistant to medication. Similarly, deep brain stimulation, a similar method of stimulating brain signals like ECT, are also being investigated for potential uses in treatment after we found success in treating Parkinson's disease and other treatment-resistant disorders. Overall, with these conclusions, we may be able to utilize the convolutional neural network algorithm to locate common areas of irregular brain activity and apply ECT and other brain stimulations to co-interactively further stimulate neural activity and treat psychotic symptoms. This concludes my presentation about using convolutional neural networks as a potential treatment option for psychiatric disorders. Thank you.